Hello, I am Mandar Joshi and I will be talking about domain modeling for schizophrenia. The reason being the abstract nature of the mental illnesses. What are mental illnesses? Why there is a need for DSS? Mental illnesses are actually complex, heterogenic. Psychiatric issues and diagnosis are a lot. There is no definite treatment protocol, and of course, there is very much insufficient data. Heterogeneity actually means the multiple forms of the disease along with common symptoms. This is the Mental Health Survey of New Zealand 2016-17. The statistical data says 1 of 6 adults diagnosed with a mental disorder, 8% adults experience psychological distress past 4 weeks. Females are the maximum vulnerable. Mental disorder is the third leading cause of health loss, which includes risk of disability, illness, and early deaths. It's seen that the Maoris use most of the mental health services. Socioeconomic deprived areas are 3 times more likely to experience psychological distress. Schizophrenia. What it is? Term schizophrenia was first coined by Eugen Bleuler. He was a Swiss scientist. He gave the 4 A's of schizophrenia, which are affect, autism, ambivalence, and associations. Schneider is another scientist who gave the first rank symptoms of thought insertion, hallucination, passivity phenomenon, and withdrawal or broadcasting. Thought insertion actually means that somebody is trying to insert some thoughts in my mind. Hallucination is a third person hallucination. Everybody is talking about me. That's the common feeling. Passivity phenomenon is like I don't understand my own body. I am not in my one own self. Withdrawal or broadcasting is a feeling of that everybody is able to hear my thoughts. We'll continue about schizophrenia. What is the WHO definition of schizophrenia? It's a disturbance involving the most basic functions that give the normal person a feeling of individuality, uniqueness, and self direction. In medical terms, it actually is the interruption in the processing of information by brain chemical pathways. Why schizophrenia happens? Due to a traumatic event, genetic makeup of the person, brain chemistry is still unknown, prolonged drug use, and hereditary. If one of your parents has it, you might have it. Where does it happen? Can happen at any age, mostly during the 16 to 25 years of age group, and of course as a complication in pregnancy. What are the brain changes that happen exactly during schizophrenia? What do you see exactly in the CT scan or MRI reports? Usually, the first finding is the hypothalamic pituitary adrenal axis hyperactivity. What it is? It actually leads to depression anxiety disorders. Abnormal neurotransmitter systems, they lead to loss of mental flows and mental focus. Hippocampal damage, it leads to anterograde amnesia, which is a loss of ability to form new memories. Old memories are still retained. Cerebral atrophy and asymmetry actually leads to dementia, seizures, and language disorders. What do you actually do when a patient enters in your clinic with a schizophrenic diagnosis? You organize a preparatory meeting with the patient. You carry out an examination. You talk to the patient to understand his social behavior. After that, you make an analysis. After the analysis, you tend to organize a final meeting. You place the patient to the rehabilitation and watch out for the condition. If the patient is better, carry on with the same measures. If he is not, you'll have to place the patient to long term rehabilitation. Now we'll talk about MMSE. It's a mini mental state examination. It is actually a preliminary test, a 30-point quantitative measure to evaluate cognitive impairment. It is actually used to assess patients' current psychopathology. It has two orientations, objective and subjective. Objective is mainly observations, and subjective are the current psychological symptoms of the patient. When you observe a patient, you actually note down his appearance, behavior, speech, cognition, and mood. And the symptoms the patient exhibits will be mostly thoughts, perception, insight. This is a chart of schizophrenia which has symptoms, stages, diagnosis, and treatment. As stated by Bleuler, symptoms can be positive, negative, and mood. Delusions, hallucinations, and disorganized thoughts comprise of the positive symptoms, negative being not social, anhedonia, which is a lack of pleasure. Apathy and ovulation revolves around the feeling of, I mean, lack of emotions, you can say. Yeah. Mood is actually irritability, tendency to suicide, depression, and anxiety. Stages can be four stages. First stage is a pre-psychotic stage, prodromal, you can say. Second stage is the actual first episode psychosis. Third is the recovery phase, and fourth is prolonged or persistent schizophrenia. Diagnosis is actually made after interview and screening. The world follows the diagnosis as per the guidelines of the DSM-5 classification of American Psychiatric Society. After interviewing, when you have figured out at least two of the mentioned symptoms which have significant impact on patient's activity experienced for greater than equal to 6 months, you tend to decide to treat the patient on the lines of schizophrenia. If you do that, the first thing you should do is suggest a structural MRI or a CT scan to figure out brain changes. As far as the treatment goes, it's lifelong. The primary goal is to manage symptoms and signs at the lowest possible dose. As per the UK guidelines and the overall approach, mostly the ideal thing to do is to opt for a therapeutic role of optimism. That is what is at most needed. Antipsychotic medication is the second thing. It's thought to control symptoms by affecting dopamine in the brain, neurotransmitter, right? Antipsychotic medication is mainly of two types, atypical and typical. The drugs mentioned here are very important because they seem to have the lowest possible extrapyramidal side effects. Also, you can give sedatives and anti anxiety. The treatment for stage 1 is a bit different because it's pre psychotic. So, the patient should learn first about schizophrenia. He should join a support group, stay focused on goals. He should ask more about social services like housing, employment, and of course, last but not the least, family therapy is the most effective. The recent research says that a shared decision making is very important in mental illnesses. It involves both doctor and the patient. More research is needed for this implementation, but it's highly accepted and wanted. It involves patient barriers. Barriers of treatment are side effects of the drugs, patient reluctance, no fixed dose, and the patient response to the medication. I have tried to establish a protocol for a patient who comes in with mental illness. So, psychosis is primarily due to three conditions: general medical condition, substance induced, and mania or depression. For shorter duration, more than 1 day, and less than 1 month, as we go, it's brief psychosis. If there is 2 weeks of positive psychosis devoid of mood problems, then it is schizoaffective disorder. If there are non bizarre delusions along with brief mood episodes and markedly impaired functioning, it is also categorized as delusional psychosis. Here it is delusional psychosis. When mania or depression includes first rank symptoms of schizophrenia along with brief mood episodes for 6 months, then you diagnose it as schizophrenia, which is our highlight over here. So, actually, schizophrenia is a long term disease which happens over a period of 6 months. Not just when the schizophrenic criteria is met, it should have the other related diagnosis along with it. Here are the users of DSS who actually will use DSS. The government funded healthcare, private hospitals, clinics, which comprises of GPs, health specialists, nurse practitioners, health informaticians, who of course work in emergency department, hospital admissions, OPD and IPD. They all will lead to the collection of personal information of patient, national health index, symptoms, history, lab reports and treatment. All this will generate an input data which is also called as electronic medical records. National Minimum Data Set, NMDS. It's used by the Ministry of Health and other allied health services for statistical evaluation and public funding. Now, this is a research approach for psychosis CDSS. There are a lot of decision support systems which have been developed till now for psychosis, and the main three are the computerized TMAP, Harmonics Group of Medical Experts of Neuroscience Research Divisions, Brazilian University Group of Psychiatrists, StatusQ, which has the relatively low rate of misclassification. It actually depends upon the expert interviews and what they have to say, and then the decision is made according to their say and experience. Multiple model DSS is developed by Suhasini and colleagues, and they propose to identify psychiatric problem using a multi-model DSS, which includes BPNN, RBFNN, and SVM. SVM is support vector machines. RBFNN is radial basis function network, and BPNN is backpropagation algorithm. We will highlight on somatizers. Somatizers are actually patients, and when those patients exhibit emotional symptoms in bodily manner, it's called a somatization. The thing is that it's hard to diagnose them, so they have to undergo intensive investigations, and it results in loss of time. They become huge burden to the healthcare systems. So CDSS can actually act here well. Limitations and advantages about CDSS can be gone through. The major limitation I will say is the abstract nature of the mental illnesses, as I have mentioned. They are hard to diagnose really because of the absence of patient's involvement into the doctor's decisions. Like if a patient has something, he will tell the actual symptoms and the doctor can make the diagnosis. But here, since the patient is mentally ill, he will not support to make a diagnosis. So that is the because of the abstract nature of mental illnesses. False judgments can be made because of the lack of patient's support. Yes, I mentioned right now, and interoperability across different EHR symptoms systems is a big problem because for smooth functioning of EHRs across the whole country is important. There is no definite overall treatment for psychiatric illness, and of course there is lack of research. Advantages, yes, of course. CDSS, because of CDSS, there will be improved efficiency and generation of electronic medical records, which will prove in planning and management of rehabilitation phase for each patient. There will be total transparency too. These are my references. Thank you for listening.